Most women with gynecological cancer thought their symptoms were nothing. My name is Saurabh Phadnis. I am a consultant gynecologist and gynecological oncologist working in London. I treat women variety of gynecological cancers including uterine cancer, cervix cancer, vulval cancer and ovary cancer. Gynecological cancer can look like normal everyday problems. Let me explain. Symptoms arising from gynecological cancer to be dramatic. In reality, they are not. They are everyday symptoms. I group them into three categories: abnormal vaginal bleeding, pain, or abnormal vaginal discharge. These symptoms overlap with everyday issues. Although these symptoms are common, they do not necessarily mean cancer, and most of the times they will not have any sinister conditions associated with them. The reason to check is simple. Early stage cancer means high cure rate and simpler treatment. Most of us think that cancer causes dramatic symptoms like sudden weight loss or collapse, but it doesn't. Most gynecological cancers usually have quiet symptoms, and often they will be present for a number of days or weeks or even months before you actually have any measurable symptoms that you would alert your doctor to. If your bleeding is unusual or different to what you usually have, this video is for you. Abnormal vaginal bleeding is one of the most important red flag signs. It is important to take this symptom seriously. Abnormal means unusual. It could be heavier than usual periods, bleeding in between periods, bleeding after sexual intercourse, bleeding after a number of months where you've not had a period. For example, when you go through menopause, you do not have a period for more than 12 months, and suddenly if you have any bleeding, that is abnormal or unusual. Postmenopausal bleeding is one of the red flag signs for endometrial cancer. Having said that, most women who are investigated for unusual vaginal bleeding will not have a sinister cause. Most causes are benign, but we have to investigate you thoroughly so that we reassure you and us that we haven't missed a sinister cause. If cancer is found, it's usually found in early stage, which means that the treatment is simple and curative. If your tummy feels full or bloated, it is worth checking the ovaries. Abdominal pain and bloating are common symptoms that are associated with ovarian cancer. Often symptoms similar to irritable bowel syndrome or gastroenteritis are common in the early stages of ovarian cancer. This means that you often are referred to specialists other than gynecologists. It is astounding that 1 in 3 women with advanced stage ovary cancer are diagnosed via an emergency admission in England and Wales. Most patients with ovarian cancer are diagnosed in late stages. Why? Because the symptoms are very subtle. They often develop over a number of weeks to months. Often symptoms that bring you to the hospital like distension of the abdomen, bloating, fullness, passing urine more frequently, or pressure symptoms, or your bowels not working properly. By the time you have these symptoms, often ovarian cancer has spread inside the belly, causing accumulation of fluid inside the belly. It is not surprising that 75% of women with ovarian cancer are diagnosed in stage 3 or 4. This does not mean there is no cure or we do not treat advanced stage ovary cancer. Having said that, because most symptoms that are associated with ovary cancer are non-specific, when investigated, most of the times we will find a benign reason. When you have symptoms that are suggestive of ovary cancer, as mentioned earlier, please see gynecologist as it may shorten the time to diagnosis. Your body can change slowly when you have cancer, long before you feel unwell. Vaginal discharge is common and not necessarily associated with cancer. The most common reason why you can have a vaginal discharge is infection, or pattern of vaginal discharge may mean something sinister. for example, blood-stained or fused watery discharge. There may be associated symptoms like abdominal pain, distension of the belly, losing weight, not feeling hungry. We have to put the whole picture together. None of these symptoms alone mean cancer, but putting together and having appropriate investigations will reassure you. The most common gynecological cancer may not be the one you fear the most. Gynecological cancer means cancers arising from the gynecological tract, cancers arising from the uterus, the cervix, vagina, or the skin of the vulva. In United Kingdom, the most commonest gynecological cancer is endometrial cancer, which is the cancer arising from the lining of the uterus. This is associated with being overweight, taking hormones, and commonest symptom of uterine cancer or endometrial cancer is postmenopausal bleeding. Ovarian cancer arises from ovaries or fallopian tubes, and the ovary is a very small organ, size of an almond after menopause, deep seated in the pelvis. Often by the time symptoms like belly getting bigger or pain in the abdomen or bowels changing or pressure symptoms, the cancer is already spread inside the belly. Vulval or vaginal cancers are rare, but if detected early, can be treated with a high cure rate. If you are attending regular cervical smear tests, then you can prevent cervix cancer. School-going children are now offered HPV vaccination. We know HPV vaccine can prevent approximately 80% of cervix cancer. Again, if detected early, cervix cancer is completely curable with a long remission. If you or someone you love has gynecological cancer, this is how we think about cure and control. As with most cancers, when they are detected in early stage, we can cure them with a very high success rate. That means that there is a long gap between completion of treatment and the cancer coming back. For example, early stage endometrial cancer or early stage cervix cancer can be completely cured with a very high cure rate. Ovarian cancer found in advanced stages, for example stage 3 and 4, we often have treatment available, but the cancer can come back. In about 6 in 10 women, it will return back in the first 3 to 5 years following completion of treatment. That does not mean we do not offer treatment or treatment is palliative. Many women are living with cancer and living with the treatment that is given to them. They live longer life, the cancer remains in the background, and we have to understand how we can help you cope with this situation. 90% of the women I see do not have gynecological cancer, but they are glad that they are checked. The most important aspect of symptoms is anything new or unusual. I often say to my patient, if you are not familiar with a symptom, and most patients would know their body well, please see a specialist or your GP. The symptoms that are red flags for gynecological cancer are abnormal vaginal bleeding. That may mean bleeding that is heavier than usual, or bleeding in between periods, or bleeding after sexual intercourse, or bleeding after menopause. Any abnormal vaginal discharge that is unusual, that is excessive, that is persistent, take it seriously and see a specialist. Any change in bowel habits or urinary symptoms that are persistent and do not go away with simple remedies, please see a specialist. One has to remember that even after doing all the investigations, sometimes we may find no cause for your symptoms. That is reassuring because at least we have ruled out anything sinister. A cause may be very simple, benign, that may be appropriately treated.